Good afternoon, and thank you for joining us, and thank you for your patience. We are having issues with YouTube, so a recording of this briefing will be made available to you later. Also, the audio of the briefing is being shared by WisconsinEye. Before our opening remarks and your questions, a reminder to maintain audio quality. Please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Also today, in the interest of time, because we have a number of participants, we are limiting you to only one question. Any follow-up questions can be directed to the DHS media line. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, joining us by phone, Major General Knapp, the head of the Wisconsin National Guard, and also available to answer questions are Dr. Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Disease, and the Governor's Chief Legal Counsel. We'll begin the briefing with remarks from Governor Tony Evers.
Thank you very much, and thank you, and welcome back from a weekend that in many ways was the start of a new normal for weekends in Wisconsin. Many of you also helped your local restaurant owners by placing orders to go this weekend, having the restaurant deliver them, or waiting while your food was brought to you to your car at the curb. It may not be what you're used to, but I'm proud of the folks of this state who are doing their best to help their friends and their neighbors and their communities. Some of you have donated, in some cases even made masks for our healthcare providers. Your generosity has not gone unnoticed, and frankly, that's what Wisconsin is all about. All of us pitching in to help each other and rising to the occasion in times of need. Still, we cannot overlook the deaths that happened because of COVID-19 that occurred over this past weekend. Our deepest sympathies are with the families and friends who lost someone to the virus. Over the past few days, I've talked with public health experts and business leaders and local elected officials all across the state. Overwhelmingly, the response I heard is that we need an all-hands-on-deck approach to stop the spread of COVID-19 in Wisconsin. In fact, business leaders have suggested that it's imperative to slow this growth of the disease and that the state cease all non-essential businesses statewide. And folks, all hands on deck means you too. I know this has been difficult and it's disrupted the lives of people across our state. But here is the bottom line. Folks need to start taking this seriously. So today I'm asking for your help. Very simple. We have been working hard to ensure that the health and safety of the people of our state as we have responded to the COVID-19 in Wisconsin. We've taken some important steps, but folks, this is important. Time is of the essence. So today I'm announcing we'll be issuing a safer at home order tomorrow. As we work to respond to and prevent the spread of COVID-19, we've had to listen and daily, by minute, to our public health experts, and to be mindful of our proactive steps that we could and will have that those things impact our frontline workers and our most vulnerable in our communities. That's why issuing a safer at home order isn't something I thought we'd have to do. It's not something I wanted to do. And it's not something I take lightly. We're all in this together, and we need to help stop the spread of COVID-19 and flatten the curve to ensure that our doctors and nurses and healthcare workers have the opportunity to do their important work. You can still go out and take a walk, go for a bike ride, walk the dogs. It's good exercise and it's good for everybody's mental health. But please don't take any other unnecessary trips and limit your travel to essential needs like going to the doctor, grabbing groceries, or getting medication. Workers providing essential care or services in our communities will be allowed to continue to travel to and from work. There will be additional details tomorrow about what this order means for you. But I wanted to give everybody the opportunity to prepare and plan ahead so that you can help do your part to keep our friends and our neighbors and our communities safe. Now let me fill you in on some things we did this weekend in our efforts to protect you from COVID-19. On Saturday, I directed the Wisconsin Emergency Management to ask FEMA, the Federal Emergency Management Agency, to assist our state in obtaining the protective medical supplies for law enforcement officers and firefighters who are at risk of direct exposure to COVID-19 while performing their jobs. This request includes 50,000 non-surgical masks, 10,000 face shields, 11,000 coveralls, 3,000 N95 face masks, and 35,000 pairs of protective gloves. FEMA will use this procurement process to help fill those orders. The request comes in addition to the state's ongoing efforts to obtain personal protective equipment, or PPE, from the Strategic National Stockpile for healthcare providers. I'm also calling on federal officials to help identify additional resources that we can make available to those who are fighting COVID-19 on the front lines. Frankly, folks, this pandemic is a bigger challenge than any one governor, agency, or unit of government can manage on its own. That's why I've asked experts in the private sector to share their time, talents, and expertise to help us get a handle on this. My great appreciation and shout-outs goes to Epic Systems, which will provide project managers and data for our efforts, Exact Sciences, which will boost our lab testing capabilities, ProMega, which will be producing the important reagent materials to be able to do the testing for COVID-19. And I've asked representatives from the University of Wisconsin Health and Medical School and the Wisconsin Hospital Association to be part of the State Emergency Operations Center. I'm deeply grateful for all that they would do to step up to the plate this way, and thanks to all of them, but there's many others across the state. In addition to the assistance from our private partners, throughout the past week, we have been working with stakeholders on organizing 5 strike teams that are operating out of the Operations Center to focus on 6 key areas: specimen collection and laboratory capacity, personal protection equipment and essential supplies, isolation facilities, surge capacities, healthcare worker, child care, and also contacts tracing and surveillance. These task forces will help ensure our healthcare workforce have the resources they need to serve folks across the state. It is critical that we have these task forces in place before issuing a safe at home order. We've made great strides in all this work, and we will have many more announcements in the days to come. I am mindful that this is a challenging time for all of us. So on Saturday, we also announced an extension of the tax filing deadline. Both state and federal taxes will now be due July 15th. I, along with Revenue Secretary Peter Barca, believe that the last thing that you should have to worry about now is a looming tax deadline. Another important date that we want you to know about and make earlier is voting on April 7th election. I continue to urge all eligible voters to get an absentee ballot through myvote.wi.gov. I encourage that. My wife and I just did that the other day. It's very easy. If we can do it, you can do it. This will make things safer for all of us and will give our county clerks room to safely carry out this important privilege of our state, that is voting. Again, I continue to offer my thanks to everybody in Wisconsin. This is a challenging time, but we will get through it, and we all have to work together. So thank you very much. Now I want to introduce Secretary-Designee of the Wisconsin Department of Health Services, Andrea Palm.
Thank you, Governor, and thanks to all of you for joining us again today. I want to begin by echoing the Governor's sympathy for the families and friends of the people who have died from COVID-19. These deaths are heartbreaking and compel us to work harder together moving forward. I want to start today updating you on where we stand. We have recorded 7,050 negative tests and 416 positive tests. We remain in the state of Wisconsin with 4 deaths. As is our usual practice, these numbers will be published on the DHS Outbreaks webpage shortly. So we're hearing the phrase flatten the curve a lot lately, but what does it really mean? It means that together we must minimize the number of people who get COVID-19 at the same time. It makes logical sense, right? The larger the number of people who have the disease at any one time, the larger the subset of those people who will have severe illness and require hospitalization. So if our healthcare system is going to have the capacity that it needs, and that means enough beds and ventilators and frontline healthcare workers to save lives and treat those who require hospitalization, we must minimize the number of Wisconsinites who have COVID-19 at the same time. And the way we do that is to double down on the efforts we're taking together to stop the spread of the disease. That is good for the people who are very sick, it is good for our healthcare providers and first responders, and it's good for you because it means you are taking the precautions that are necessary to keep from getting sick and spreading the illness to others. To that end, at the governor's direction, tomorrow I will sign the Safer at Home order to further protect Wisconsin from COVID-19. This is a necessary step to slow the spread of the disease and allow us to continue to prepare the healthcare system for this pandemic. As the governor noted, we are working through the final details and will have more information for you tomorrow. But we need your help to flatten the curve and protect our healthcare system and our most vulnerable citizens. That will take a deliberate and continuous effort by all of us to stay home. You will be safer, your communities will be safer, and Wisconsin will be safer. Also, please remember to continue your good hygiene practices. Cover your coughs and sneezes. Wash your hands frequently with soap and water. And whenever it's possible, we encourage you to use telehealth to keep visits to clinics and hospitals to a minimum. Again, for your protection and for the safety of our frontline healthcare providers. Additionally, if you're having symptoms, please call your doctor before you go to a healthcare facility. We know that older adults are particularly at risk for complications from COVID-19. And just as schools are a major source of nutritious meals for our students, meal programs are important for the health and well-being of Wisconsin's older residents. So I'd encourage you to go to our DHS webpage where we have spelled out how this important service can continue to be provided safely. Over the last several weeks, DHS has had the full support of our state government. I want to thank Governor Evers and our colleagues across the state for your partnership. We are all working, along with our local public health departments and private sector partners, to protect the health and safety of Wisconsin residents. Thank you for your efforts during this challenging time. They are greatly appreciated. And now I'm going to turn it over to Major General Knapp, who is the Wisconsin National Guard leader.
Thank you, and good afternoon. This is Major General Paul Knapp, the Adjutant General and Director of the Emergency Management for the state of Wisconsin. Currently, we have more than 300 Wisconsin National Guard citizen soldiers and airmen mobilized to state active duty to assist the state in its COVID-19 response. To date, we've completed a handful of missions. One of them was returning the cruise ship passengers transport mission. So what they did is they flew those passengers back into Wisconsin, and then our National Guardsmen transported them to their home of record. We also have 6 medics dispatched to the senior living facility in Grafton, and they should be completing their mission there in the next day or so, as they'll get pulled back because the local facility has been able to retain additional staffing to cover their staffing shortage. And that's a great example of what we're designed to do as a National Guard in backing up the Department of Health Services in this crisis. When there's a shortage in something like in that area, particularly having to do with medical in this case, we can come in the short term while the local facility adjusts their staffing and recruits more people to complete that mission, and then we'll bring our folks back. One other thing I'd like to talk about today revolves around the State Emergency Operations Center and one of the initiatives that we've been working hard on and we're getting ready to roll out. It's a PPE buyback program, and we've created a website that should be live within the next 48 hours. And what it does is it offers to take in any PPE donations, or we're willing to buy back PPE from businesses that have closed as a result of the outbreak and no longer have use for the PPE, so that we can buy it back or take those donations and reprioritize them and get them out to the first responders and medical folks that need them the most. Some of the items that we're particularly interested in are the N95 particulate respirators, face masks, gloves, isolation gowns, face shields, surgical gowns, Tyvek coveralls, and thermometers. We'll house those materials in a secure state warehouse and then manage the distribution of them based on the priorities set forth, much like how we're distributing the Strategic National Stockpile PPE. As the governor mentioned, we have a couple different streams of input for PPE from the national level, and the other stream is from FEMA, where we're particularly sending in requests to cover the needs of the local law enforcement first responders. What we'll be able to do then is make informed decisions to best maximize known critical resources in the shortest amount of time. There will also be flexibility in this platform where we can add additional critical needs, such as formula and diapers for our child care facilities, and hand sanitizer and other items that we definitely will need throughout this crisis. One of the things I'd like to just remind everyone is that as we go through this crisis as a united state across the state resources, is that everyone would use a calm sense of urgency in responding in this time of need. And at this time, we'd like to open it up for questions.
A reminder that we are only taking one question per reporter today, and to maintain audio quality, please keep your phones unmuted until it's time to ask your question. We'll begin question today with David Walberg from the Wisconsin State Journal. David?
Yes, hello, thank you. I believe Governor Evers specified how much PPE we've gotten from FEMA for first responders. Can you be more detailed about how much has come from the stockpile for healthcare workers and how much more you're anticipating?
Great question. I don't have that information right in front of me right now, but the most recent request was through FEMA, and the numbers I gave were, oh gosh, I certainly don't have those memorized. We'll get that information to you, David.
So David, I do have the numbers from the distribution from the Strategic National Stockpile, which is a part of the estimated allocation that we will receive, and I'm happy to run through those if you're ready. So N95 respirators, we received 54,709. Surgical masks, we received 130,326. Face shields, we received 24,816. Surgical gowns, we received 20,233. Coveralls, we received 104. And gloves, we received 72,044 pairs of gloves.
And from FEMA, I found it. From FEMA, we have requested 50,000 non-surgical masks, 10,000 face shields, 11,000 coveralls, 3,000 N95 face masks, and 35,000 pairs of protective gloves. And that is exclusively for our law enforcement officers and firefighters. I will say, even with those two, we are still going. That's not an end point for us, is what I'm saying. And it's critical that we have a good start, but we will be continuing to seek out other sources if
can you hear me? Yeah, sorry. Yeah, thank you very much for the call today. I was curious if, I know that the plan right now is to continue with the election on the 7th. I'm curious, we've kind of heard concerns from some poll workers about not being able to have enough to staff those. If that does become the case, or even if it's like an election day shortage like Illinois saw, is there any sort of plan in place for kind of addressing that, whether that might entail having National Guard members there? I was just kind of curious how you kind of plan to address, potential shortages.
Hi, this is Brian Nelson, the Governor's Chief Legal Counsel, and I can answer that question for you. So at the State Emergency Operations Center, one of the task groups that's set up is meant to provide logistical and supply support for the Wisconsin Elections Commission and the clerks around the state. So their task is to make sure that there's adequate supplies, including cleaning supplies and hand sanitizer, ballots, envelopes for ballots, and other materials that they need. We're also looking at everything that we can do to make sure that the election can be held in a fair and safe manner. And that's why, as the governor has mentioned numerous times before, and a record number of people have done this, it's very important that people today request an absentee ballot. And anyone can do that by going to myvote.wi.gov. We've seen record numbers of people to do it, and it's the safest way to vote and participate in our democracy.
Thank you, Mitchell. To Eric Dunn now from Wisconsin Examiner. Eric.
Thank you for taking this. Over the weekend, there was a statement from the GOP legislative leadership urging against shelter in place. Governor Evers, have you been in communication with the Republican leadership of the legislature today, and what kind of response, if so, have you gotten from them about your plans to institute this new order?
Yeah, I've been working with all sorts of folks, local leaders. I've been on the phone constantly for the last several days on this issue. Business leaders, I had a conference call last night where those business leaders were insistent on having the safer at home order, as well as federal officials. I have not personally connected with the leadership yet today.
Thank you, Eric. Robert Chappell from Madison 365. Robert.
Hi, can you hear me?
Yep.
Do we know? Do you have any additional details yet on the timing of this order? Or is that all going to come? Like how long it's going to last, and who is deemed essential? Are we at that point yet, or is that coming tomorrow?
That's going to come tomorrow, as well as we want to give people some buffer time to implement what is happening. But the dates and time when it's effective, when it goes away, will be determined tomorrow and announced tomorrow.
Thank you.
And then, as a follow-up, those workers that are deemed essential.
We're moving on to Morgan from WNTV NBC 15 in Madison. Morgan. Also from NBC 15, Cashwell.
Hello, can you hear me? This is Morgan.
Hi, Morgan.
Hi, one thing we're wondering about is surge capacity as far as hospital beds, if there's any plan for potentially having UW dormitories be used towards the surge capacity for possible patients.
So surge is one of the major high priority streams of work that we are doing together at the SEOC. And as the governor mentioned, we have invited representatives from urban, rural, and suburban hospitals to embed with us so that we are all working together across DHS, the hospitals, and then our logistics and execution partners through General Knapp and the WEM, so that we are building a surge capacity system that is ready to meet demand. That work is actively happening now. The specific facilities have yet to be determined, and we will continue to work closely with our partners to make sure that the surge plan is ready when we need it.
Thank you, Morgan, to Danny Maxwell from WKOW. Danny?
Hi, this is Emily in replace for Danny at WKOW. My question is for the governor. Governor, what's changed since Friday when you were urging people that, when you said you didn't think there was going to have to be a type of shelter in order place? What's changed since Friday to now put that into place tomorrow?
Sure, and we continue to, we have in the past and will continue to ask people to stay at home, stay at home, stay at home. However, I've always, as I've said with you and I've said with others, this was not something I felt strongly that we needed to do, but since I communicate regularly with our great healthcare staff as well as other medical and healthcare professionals, they have significantly suggested to me that this is the best way to curb the virus, that we were not getting to the point where we wanted to be, and so I accepted that advice. Science is important to me, and I followed the science. But in turn, I also had many conversations, as I said before, across the state with both local folks and also people from the business community that convinced me that this is the right thing to do. It's important to consider all people, but I will tell you that the experts and the scientists made it clear to me that this is the way for us to solve this problem.
Thank you, Emily. This is Charlie Smith from WORT Radio. WORT.
Hi, yes, Dylan Brogan filling in for Charlie. What are going to be the enforcement mechanisms for ensuring that the order tomorrow will be complied with?
Hi, this is Brian Nelson, the Governor's Chief Legal Counsel. This order, like all other public health orders, is enforced by local law enforcement and including county sheriffs. And, we fully expect and hope that people will comply. But the Governor said, and Secretary Palm said, we really all need to come together and do this if we're going to bend the curve here. So while there is an enforcement mechanism, the most important thing is we need everybody to chip in and play their part.
Thank you, Dylan. Stephanie Fryer from WISC-TV in Madison. Stephanie?
Hi, can you hear me? This is Matt Clark filling in for Stephanie.
Yes, we can hear you. Go ahead.
This question is for the Governor. What kind of coordination have you had with other states? I know other governors around the country have been working with the surrounding states to kind of make sure you're on somewhat of an even or on the same page. Has there been coordination with Minnesota, Illinois, Michigan?
In particular, I'm on regular communication with the governors of Michigan and Minnesota. And so yes, the answer to your question is yes. We discuss this and we have an idea what each one is about to do. But we're all different states, so that's the decisions are made state by state. But also, it's important for us to show a common theme, and a common theme is around stay at home. We can do this. It's pretty simple. Stay at home. This is a serious disease. We're trying to control it. Stay at home.
Thank you.
Right, thank you.
Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for having this call. Could you tell us what percentage of our positive cases have been hospitalized?
Sure. This is Dr. Westergaard in the Division of Public Health. We don't have a precise number on that, but what I can tell you is that our at the time of diagnosis, the number of individuals who have been hospitalized in our state and nationally is around 10%. The largest series that was published describing the early experience about the first 4,000 cases in the U.S. was published by the CDC last week, and it was about 12% overall. So we are actively trying to develop better informatics systems so we know exactly who is hospitalized when. That's a priority for us as it becomes a healthcare system capacity. But right now, our surveillance systems are
that is one of the important things that we are very grateful to our partners at Epic who have come into the SBOC to work with us is on these issues of real-time data as it relates to the supply of beds and who's hospitalized, and some of those things that the more real-time we know, the better we will be prepared and able to respond. So we are very grateful for their participation in this response. But I think it also speaks right to the whole issue of flattening the curve. Our ability to make sure that the 10% or 12% of folks who are going to require hospitalization have what we need in the state of Wisconsin means that we need to reduce the number of people infected and therefore reduce the number of people who will experience severe illness as much as possible, so that those 10 to 12% of folks who are going to require hospitalization is a number that is manageable within our healthcare system. And that is why the efforts we are undertaking and the scientists, as the governor said, have recommended that in order to do that, we need to increase the urgency with which we are staying at home, with which we are taking seriously our responsibility not to be in contact with others that we might infect. I think the other thing that's important about the science here is what we are learning about folks who are asymptomatic being contagious. And that only further instructs us that the best way we can keep the state of Wisconsin safe and those who are most vulnerable to severe illness is to stay at home. And that will protect everyone so that we can maintain the capacity of our healthcare system to serve folks who are going to need to be hospitalized from this disease.
Thank you, Molly. Patrick Marley from the Milwaukee Journal-Sentinel. Patrick.
Hi, thanks for this call again. I wanted to circle back to the election. Are you going to deem polling sites to be essential services, and are you giving any thought to making this a mail-only election?
Well, certainly the issue of having as many absentee ballots and mail ballots as possible is absolutely top priority. Always has been, understanding that this is an emergency that we're in. What we're doing now, Patrick, is to make sure that we understand at the state level what needs the local election folks have as it relates to facilities and number of people and all that. And so we're constantly evaluating that. We're going to be working with them and the Wisconsin Elections Commission to answer your question. But we're in the process of evaluating that. But the message still is and will be stay at home, vote by mail.
Thank you. Thank you, Patrick. David, also from the Milwaukee Journal-Sentinel. Moving on then to Victor from CBS 58, Milwaukee. Victor?
Hi, good afternoon. Thank you again for the call. As we've talked about the growing calls for concerns about the election, one of the concerns is about the safety of poll workers. And we talked about last week about the participation for PPE. I'm wondering, is there any coordination to supply any of these PPEs to these poll workers and municipalities affect large numbers of people voting in person on election day?
The answer is yes. The answer is yes. We have, in fact, today I've talked to mayors about this issue as far as protection devices, whether it's masks or other things for our poll workers. Many of them already have that, and as part of the analysis that we're doing with all municipalities and the Election Commission to make sure that A, the place is safe, the polling places are safe, and B, that we feel comfortable that the health needs of the people of the state of Wisconsin are met.
Thank you, Victor. Also from CBS 58, Brendan Cullerton. Brendan?
Hello, can you hear me?
Yes, we can.
All right, I was wondering, should most people assume that they will be required to work from home when this order goes into effect? And can you give a couple examples of exempt businesses?
Well,
Hi,
go ahead.
This is Ryan Nelson, doing the Governor's Chief Legal Counsel. One of the benefits that we've had is being able to look at what's worked in other states and what hasn't worked, and also, as the Governor mentioned earlier, be able to get feedback from business leaders, small and large, across the state and local officials. And so in terms of your question about whether everybody will have to work at home, no. Just as in other states where what's considered essential is a wide variety of key businesses and industries. So, we need to make sure that we're maintaining our supply lines. We need to make sure that we're maintaining food and for other items on the grocery store shelves. So all of that will be remaining open. All of that will still be supplying our grocery stores so that we'll be able to get the goods and services we need. So there's going to be a large number of businesses that will still remain open, just like we've seen in other states, including neighboring states.
Thank you, Brendan. And a reminder, we'll have more details about Saber at Home released tomorrow. To Andy now from WISN in Milwaukee. Andy? Andy from WISN?
I'm sorry, this is Matt at WISN. So you'll have, just to follow up on that quickly, you'll have more specifics on what exactly is a non-essential business tomorrow. You can't get any more examples today?
Well, certainly, no, that is accurate. But if you want an example that the federal government has, and I'm not saying that that's what we're following, but the federal government on their website, CDC website, I believe, have defined essential and non-essential from their vantage point. This is a Wisconsin vantage point, so it will not be identical. But if you really need something just to have a general idea what it's about, I suggest you look at that.
Thank you, Julie.
Okay.
Jeremy from Urban Milwaukee. Jeremy from Urban Milwaukee. Okay, we'll move on then to Ben Jordan from TMJ4 in Milwaukee. Ben? TMJ4? Okay, moving on then to Sean Ryan from Milwaukee Business Journal. Sean?
This is Rachel from TMJ4.
Hey, Rachel.
We know that you said the state has received PPEs, but where are they? Have they been distributed already? And how are they getting the supplies to frontline workers?
So we will, this is Andrea, and General Knapp may want to jump in here as well. We have received that first allocation of our estimated supply from the Strategic National Stockpile, and we will complete deliveries to locals today, and have prioritized long-term care, hospitals, EMS, and in-home and personal care agencies. But General Knapp, if you want to give any more details on the logistics side of this.
Sure. On the logistics side, the big distinction here is that we want to make sure everyone knows that we're doing the distribution in conjunction with requests from the local emergency managers and health officers. So those folks at the local level put in their requests, and then when we receive Strategic National Stockpile assets of PPE, then we distribute them to those folks based on the priorities that Secretary Palm mentioned.
Thank you, TMJ4. Now to Sean Ryan.
This is Jeremy from Urban Milwaukee, if I can jump in.
Let's move on to Sean from Milwaukee Business Journal, please.
Hello, can you hear me?
Yes, I can.
All right. How will this order treat the construction industry? Will it be considered essential, and could work continue on private construction sites?
As I said before, the decisions on that are being made, and we'll have a better idea with that tomorrow. We're reaching out to local officials. We're reaching out to business folks across the state and municipalities to make that determination. Obviously, it's a very important one. It's not soup yet. Otherwise, I would tell you it is soup, but it will be close to being soup tomorrow.
Thank you, Sean. We'll go back now to to Jeremy from urban Milwaukee. Jeremy? You still with us?
My question is regarded to the number of tests that have been administered. The daily total of negative tests went under 1,000 for the first time. Is that an indication of the testing supply?
Do you mean the difference between the total negatives yesterday and today?
Correct.
So I think it is actually a sign of our expanding capacity, right? What is happening through the state lab is about 400 tests a day. We are seeing more of our healthcare partners in clinical labs like UW, Freighter, Children's Hospital in Milwaukee, others coming online with testing capacity. And so what you're seeing is, in addition to the 400 that the state lab is doing, this growing number of negative tests that represent what we're hearing back from these other clinical labs around the state who are coming online and expanding their capacity.
But that number went down. It was 1,702 on the Saturday to Sunday number, and then the negative test number was only 855 on Sunday to Monday.
Jeremy, I'm sorry, we only have time for one question today. We'll move on. Excuse me, to Angelica Sanchez from Fox 6. Angelica from Fox 6. Or Amanda from Fox 6. Or Brian from Fox 6.
Hi, this is Amanda from Fox 6. We have heard from several people, seen posts about people getting together to make masks to donate to the medical community. Realistically, are those masks effective? Are they going to do anything? Should people keep making them?
I'm going to let the doctor in the room answer that question.
Right. I think in a contingency or crisis situation, we look for all options. The general, there's two kinds of masks in general. The N95 respirators are the ones that filter the air from that we use for people who are in ICU, where there's aerosols being generated, and there's good data that those prevent transmission. There's also good data that there are simple barrier masks, the ones that we use during surgery, that don't necessarily filter the air, but just block or prevent droplets from going into someone's nose or mouth, can also be effective. We don't have science that homemade reusable fabric masks are as effective, but it's worth exploring, and we're supportive of the idea. Our hope, our first choice, is that the supply chain will be sufficient, that we'll have the standard disposable masks. But better than nothing is to reuse and use alternative sources. So we're open to that, but we're considering that a contingency situation that we hope to not get to, and we're prioritizing the standard of care, which is the disposable surgical masks, as much as we can.
Thank you, Amanda. So Marty Michelson from Milwaukee Public Radio. Marty?
Actually, this is Brian from Fox 6. You called my name, but then Amanda jumped in. Could I go ahead and get a question in?
Hi. It's Marty Michelson.
Brian Colson, and then we'll come back to you. Brian, go ahead, please.
Okay.
Yeah, so obviously things are getting more and more strict in terms of what people can do. Over the weekend, though, even under the current situation, grocery stores were packed. And I've heard from a lot of people who say there's all of this talk of social distancing, and even under these new orders, grocery stores are going to be one place people can go. Is there any concern that people are congregating in large numbers in small spaces at Walmarts and grocery stores and other places? And is there anything that can be done to alleviate concerns of spread in those places?
So I think one thing that I will say, in anticipation of this order tomorrow, I would encourage people not to all go to the grocery store at the same time today, because it will remain, those grocery stores will remain open. People should go once a week to do their grocery shopping, and we should maintain really strict social distancing in those cases, the 6 feet. Make sure you've got 6 feet between you and another person. Avoid physical contact. But the truth of the matter is people need to have food, and so people need to go to the grocery store. I think we need to explore and stand up additional opportunities for delivery of groceries. But folks need to be able to go to the grocery store. I would just encourage people to do it in an orderly way that maintains 6 feet of physical separation between you and other customers.
Yeah, and we're encouraging grocers to help in this area. And we've seen that happen, where they're being helpful, giving some people some sanitizer on the way in and the way out, and making sure that there is some distance. Obviously, not all places are doing it. Not all places can do it because of because there's a rush for groceries. So I'd also encourage, frankly, people to think about what would be the most likely time. I would say probably 5 o'clock in the afternoon, probably going to be pretty crowded. I think the grocers can tell us that, and we'll be glad to share that information. But we have many of them are 24-hour operations, and we should be able to find time where that isn't a problem.
Thank you, Brian. Now, thank you for your patience, Marty Michelson from Milwaukee Public Radio.
Hi, thanks for taking my call. Just getting back to essential, non-essential, what does this mean for bars and restaurants? Do they have to cease pickups and deliveries?
This is Ryan Nelson, the Governor's Chief Legal Counsel. We expect the bars and restaurants provisions to be similar to that of the current order.
Thank you, Marty. Casey Nelson from WTAQ in Green Bay. Casey?
Hi, hello, can you hear me?
Go ahead.
All right, my question is, what is really the difference between a shelter-in-place order and the stay-at-home order here?
It's pretty simple. We want people to stay at home. Shelter in place could mean I'm walking down the street and I'm taking shelter right here. Stay at home means stay at home.
Thank you, Casey. And Brian from WLUK in Green Bay. Brian?
Hello. What facilities designated to serve as coronavirus patient sites, like UW Oshkosh, are required to do before they're able to begin taking patients, as far as sanitizing, things like that?
I guess are they taking patients for a particular thing? I'm not entirely sure I understand your question.
So it's been designated as a potential site for having coronavirus patients. So is there anything that they're going to need to do before they can begin accepting patients there if it were to happen in the future?
So all the hospitals across the state will be able and are serving coronavirus patients. There is not a particular designation to do that work, and it is why we are working together on this surge and isolation issue so that we are able to make sure we have the capacity that we need to serve everybody who needs hospitalization.
Okay, and if you were to use these other sites like college campuses, I mean...
Moving on then to Addie from WFRB in Green Bay. Addie? Moving on then to John Knight from NBC 26 in Green Bay. John?
Hi, good afternoon. As it relates to the order in effect tomorrow, without specifics today, do you anticipate a scenario where some workers, say construction, could go to work and then be told to go home in the middle of their shift?
No. You will have a buffer time to make sure that everybody understands that. Now, there may be a time when there's a decision made that X company is not essential and the owner decides to make that decision on their own, but we will have a buffer time so that would not happen.
Thank you, John. And a reminder that we will have a full details of safer and holiday tomorrow. To Sarah Thompson from WBAY in Green Bay. Sarah? Sarah Thompson? Okay, moving on then to Austin Montgomery from the Beloit Daily News. Austin. Austin Montgomery?
Hi, this is Sarah Thompson. I'm sorry, can you hear me now? Okay, thank you. I know there are not a lot of specifics yet on what exactly is considered essential and non-essential, but we've received a lot of questions from churches, since that's obviously not a business, as far as like live streaming, that sort of thing. Would those be considered essential?
Well, if they're live streaming, that'd be fine. I mean, it's an issue of the number of people in a facility. So this next decision wouldn't affect live streaming of church services.
Thank you, Sarah. We'll try one more time for Austin Montgomery from the Beloit Daily News. Okay, we'll move on then to Jessica Van Agren from Up North News. Jessica?
Hi. Hi, thanks for taking my call. Just a point of clarification. At the start of the call, I felt Secretary Palm said there was 4 deaths, and I'm looking on the website, the DHS website, and it says 5. Can you let me know if it's 4 or 5 deaths?
We absolutely will. I was given the number 4, but I assume our website is probably correct, but we will confirm with all of you.
Okay, all right, thank you.
Thank you. Mason Dowling from WAOW in Wausau. Mason? Mason Dowling from WAOW? And then we'll move on to John Leisfeld from the Eagle Herald in Marinette. John? Okay, Maddie Hines from the Appleton Post-Crescent. Maddie?
Hi, thanks for taking my call. I appreciate it. I have a question about testing. So knowing that we're limiting who we're testing only those tier 1 and 2, or prioritizing those tier 1 and 2 patients, I'm just curious about what effect that has on how well we can track who's infected and how the infection is spreading throughout the state. I'm just curious if that limits our knowledge of that by prioritizing testing from a certain group of patients.
I'm going to ask Dr. Westergaard to talk about the way this works.
Yeah, I'd be happy to talk about our processes for that. So when we prioritize testing for people for whom it's most important to know for their own management clinically, but every individual who is confirmed as a positive case gets a detailed interview by public health officials to see who has been exposed. And those individuals who become symptomatic can be counted as probable cases. So we are in the process of developing an enhanced surveillance system where we can report and track and understand more readily the number of probable cases, because it's definitely going to be the case that the number of positive tests isn't equivalent to the number of people with the infection in the state. This has been universally true in all countries that have this epidemic, which is now all countries in the world, that a good number of active cases that are known to public health don't have a positive test, and that's okay. To understand the details of where the epidemic is going, where we are on that curve, we use a variety of strategies. Counting severe hospitalized cases is one, using what's called syndromic surveillance, meaning the number of people who come into medical care for evaluation of a compatible illness is something that we can track using various data sources. So we use a number of different perspectives to understand exactly where the epidemic is going, in addition to testing hospitalized patients.
Thank you, Maddie. And in the interest of time, we only do have time for one more question, and we will send that to Scott Bauer from the Associated Press. Scott?
Hi, thanks everybody. I was wondering if anyone could explain why the number of confirmed cases only went up about 9% today. We had been seeing between 30 and 40% increases daily. Is that a sign of testing issues, of weekend issues, or is it a sign that all of these efforts are actually starting to have some impact?
Sure. I would say the only of the possible answer that you propose that we can say with certainty is that we haven't heard it's because of testing limitations. In fact, our capacity to do testing is higher. So it may be limited by the fact that fewer people are seeking care over the weekends, and we certainly hope it's the case that it's because the number of cases is not growing. But I think that the normal, the caveat to all of that is that a large number of people with known infection will have minimal symptoms and not present to medical care. So we always have wide uncertainty around our numbers of cases, and that's one of the things that we're working hard to use a number of different data sources to be able to understand better.
Thank you, Scott, and thank you all for joining us today. I'm sorry we didn't get to all of your questions, but any of your questions can be emailed to dhs@dhs.wisconsin.gov, or you can call the media line at 608-266-1683. Also, a reminder to continue to monitor the DHS Outbreaks and Investigations page and the
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.